Today, we're diving into how genetic testing and personalized medicine are revolutionizing healthcare. Let's jump right in.
I'm so excited about this topic. So, what's the big deal with personalized medicine?
Well, it's all about tailoring treatments to the individual,
hmm
based on their genetic makeup.
So, instead of a one-size-fits-all approach, we customize it?
Exactly. It's like having a bespoke suit made just for you rather
Right.
than buying off the rack.
That sounds amazing. How does genetic testing fit into this?
Well, through a simple blood or saliva test, we can determine how someone metabolizes certain medications.
Interesting. Wait, you mean our genes affect how medicines work for us?
Yes, exactly. Our genes code for enzymes in the liver called CYP450, which metabolize drugs.
Oh, I see.
But genetic variations can make these enzymes more or less active.
So, if the enzyme is less active, the drug might not be processed properly?
Precisely. In such cases, the medication can build up in the body, leading to side effects or even toxicity.
Yikes. That's concerning. Do we have any real-life examples?
Yeah, actually, there was a woman named Greta, 89 years old. She was feeling dizzy and had several falls.
Oh no. What was happening to her?
Well, she was taking metoprolol for high blood pressure, but she was a poor metabolizer for that drug.
Uh-huh.
It wasn't getting broken down properly.
So the drug was accumulating in her system?
Exactly. It's like pouring water into a glass with a clogged drain, it just overflows
Right.
eventually.
That's a great analogy. So what did they do for her?
They conducted a pharmacogenetic test, realized the issue, and adjusted her medication.
Perfect.
She improved significantly after that.
That's incredible. But why isn't this more widespread?
Well, there are barriers, like the cost of testing, lack of awareness among healthcare professionals, and the complexity of interpreting results.
I see. But wouldn't investing in this save money in the long run by preventing adverse drug reactions?
Absolutely, it would.
Exactly.
It's just a matter of shifting perspectives and allocating resources up front.
So what role do nurses play in this whole process?
Nurses are crucial. They observe patients, administer medications, and can spot side effects early on.
Mm-hmm.
They can bring valuable information to the medical team about how a patient is responding to treatment.
That makes sense. So they can help decide if a pharmacogenetic test is needed?
Exactly. Their close contact with patients puts them in a unique position.
Right.
Plus, they can educate patients about personalized medicine and its benefits.
But do nurses have enough training in this area?
Well, currently there's a gap. Many nursing programs don't cover pharmacogenetics extensively.
I see. That's a problem. If they're expected to play a central role, they need the knowledge.
Absolutely. There's a need for more education and awareness.
Definitely. Maybe continuing education programs could help bridge that gap?
Exactly. Workshops, courses, and integrating pharmacogenetics into the curriculum would be beneficial.
Agreed. You mentioned earlier that about 70–80% of medications are metabolized by CYP450 enzymes?
Yes, that's correct. So
Wow.
genetic variations can impact a large number of commonly used drugs.
That means many patients could potentially benefit from personalized dosing?
Precisely. For example, drugs like antidepressants, beta blockers, and pain medications are affected.
Interesting. It's like, having a key that fits perfectly into a lock, right?
Exactly.
Yeah.
When the key doesn't fit, the medication won't work as intended.
So, are there any studies showing the benefits of pharmacogenetic testing?
Yes, actually. Recent studies indicate that using PGX testing can reduce adverse drug reactions by about 30%.
That's significant. Wow, that's a big difference. So, what's holding us back from wider adoption?
Well, as I mentioned, there are barriers like cost, lack of awareness, and complexity in interpreting results.
Right. But hold on. Isn't there a risk of overcomplicating treatment plans with all this genetic information?
That's a valid concern.
Yeah.
But with proper training and support systems, healthcare professionals can handle the complexity.
Maybe. But don't you think it might overwhelm patients with too much information?
That's possible, but nurses and doctors can help explain it in understandable terms.
I suppose.
It's about effective communication.
Also, doesn't this challenge the traditional approach to prescribing medications?
It does, but in a positive way. It's moving from trial and error to a more precise method.
Right. But are healthcare professionals ready for this change?
Training is crucial. Healthcare
Mhm.
professionals need education on pharmacogenetics to effectively use this information.
Maybe we also need to update policies and guidelines?
Absolutely. Incorporating pharmacogenetic information into prescribing guidelines can help make this standard practice.
Exactly. It's a lot to consider, but overall, the benefits seem to outweigh the challenges.
Definitely. The potential to reduce adverse drug reactions and improve efficacy is huge.
Yeah. Well, it's certainly an exciting time for medicine. Thanks for shedding light on this topic.
You're welcome. I'm glad we could discuss it. It's important to stay informed as these advancements unfold.
Absolutely. It's really fascinating how our genes influence so much.
Yeah.
Do you think genetic testing will become routine?
Well, as costs decrease and technology improves, it's becoming more feasible.
Right.
Some countries are already integrating it into standard care for certain medications.
But what about patient privacy and concerns over genetic data?
You're right. Privacy is important. There need to be strict regulations to protect patient data. It's about
Exactly.
finding the right balance.
Okay, that makes sense. So, overall, personalized medicine has a lot of potential?
Definitely. It's like having a roadmap tailored to each patient's needs, leading to better
Mhm.
outcomes and fewer side effects.
Well, I'm convinced. Do you think we'll see this become standard practice soon?
I hope so. As technology advances and awareness grows, it should become more accessible.
Let's hope. Thanks for sharing all this. It's been really enlightening.
My pleasure. It's an exciting time in medicine, and personalized care is the future.
Absolutely.